Hi everybody, and welcome to the Facebook Live. My name is Dr. Eileen West, and I'm a general internist who specializes in internal medicine women's health. I have a private practice in Fairfax, Virginia. I'm affiliated with Inova Fairfax Hospital and also with a wonderful organization called Miss Medicine. If you'd like to learn more, go to eileenwestmd.com and you can find a lot more information there. Thank you for coming to my first Facebook Live session. I've been offering regular Zoom calls for my patients and decided to try this new venue. I'm happy to be able to offer this information session for you. So what I'd like to do is start by going ahead and giving some COVID-19 updates. And today is September 3rd, 2020, and I'd like to start with some of the statistics for COVID-19. So we have 25,720,000 plus cases now worldwide, and in the last few days, the rolling average has been 265,000 new cases daily, and a total of 856,000 deaths worldwide. Unfortunately, the United States is leading the pack with over 6 million cases, and Brazil and India are second and third for new cases. In the United States, there have been more than 6 million cases and 43,000 new cases per day over the last few days, and a total of 185,000 deaths. Just to put some perspective on that, the first case in our country was diagnosed January 22nd, and it took 98 days to reach the first million cases. The first to the second million cases was 44 days. Then to reach 3 million took another 27 days. And to reach the 4 million mark was only 14 days. So you can see the time frame is shortening, and it's an exponential curve growth, which we anticipated and are of course concerned about. The stretch from 5 million to 6 million did take a few days longer, to a total of 21 days, which may or may not be interpreted as a good sign. We can always hope. The top 3 states with confirmed cases in this country, California has more than 600,000 cases now. Texas is second. Florida is third. We're still seeing high numbers in the coastal states. Virginia is sitting at about number 16 right now, and it's been fairly level over the last 14 days. We have a total in Virginia of 121,593 confirmed cases, and sitting at about 1,000 new cases per day across the state. A lot of that activity is still along the coastal areas of Virginia and Hampton Roads. To date in our state, there have been 2,612 deaths. So we work in Fairfax County, Virginia, which is in Northern Virginia, and so far Fairfax County, which is a big county, has seen over 18,000 cases. We're averaging about 97 to 100 cases per day right now. It's been significantly higher at our peak in mid-May. We were up in the 380 to 400 cases per day. And overall, we've had a total of 575 deaths. We've had over 2,000 patients hospitalized since March, and the Latino community continues to have the highest percentages of cases. They've really had a rough time with COVID-19. So our hospital system here in Inova has 5 hospitals and has tested nearly 88,000 people. We've had 11,000 positive cases, and right at the moment in our health system, there are 76 hospitalized patients for COVID. So the demand on ICU beds, etc., is manageable, and staff have the supplies that they need. So I'd like to talk about a couple of the stories in the news the last couple of weeks. One of the things that people are talking about is the real goal to ramp up testing, and there are lots of different kinds of COVID tests available, but the goal for the CDC is to reach 30 million diagnostic tests per week across the country by October. 5 million of these will be the nasal swab PCR tests, which is the kind that we do here in our practice. And then 25 million of them will be the rapid antigen nasal swab tests or saliva tests, which are becoming available. And so the objective is to do more testing so that we can more clearly identify people who are at high risk and who are positive, and therefore get them isolated as needed so that other people in the community can continue to live and work and do the things that they need to do, knowing that the positive cases have been identified. So it's an adventurous time. The tests are not perfect. We know that. The rapid tests are, they tend to be a little bit less accurate about with the test results. What you gain in speed, you lose in some accuracy, but that's well made up for if you do serial testing with the rapid antigen. So yes, we do offer COVID testing at the office. You can call for a COVID consultation, and I'll help to determine what the appropriate testing for you is. We do both the antibody testing and the antigen nasal swab testing here at our practice. So one item that came up a lot in the news this week was a story about 6%. There were 6% cases. The phrase only 6% was trending on Twitter over the weekend. There were some posts that went out that accused the CDC of quietly reducing the number of deaths due to COVID-19 based on a 6% total, and many of those posts have now been taken down because there were misinterpretations of the data. And I just wanted to explain that a little bit because I think it might be helpful for people to understand where that 6% number comes from. So for 6% of deaths in this particular study that was cited, COVID-19 was the only cause mentioned on the death certificate. And that meant that only 6% had no other underlying health complications, no health issues besides COVID-19 reported at their time of death. But on average for the rest, the other 94%, there were 2.6 additional conditions or causes of death listed. And if you spend any time in a hospital or in an intensive care unit, one of the things you discover is that when someone dies, multiple reasons can be listed on their death certificate. In fact, it's rare for people not to have more than one cause of death. And what we understand about the virus is that people with certain conditions like cancer or diabetes or asthma are at higher risk of complications from contracting COVID-19. And so are older individuals who frequently carry some of these diagnoses already. So the key take-home point to all of this is that 6% isn't the number of people exactly who died from COVID. It's the number of people who may have been closer to death than the rest of us who died of COVID-19. But the rest were, in fact, significantly affected by COVID-19, which potentially took them sooner than their time. I also wanted to touch a little bit on what people are talking about with vaccine distribution plans. This week there's a big push to outline how vaccines will be distributed once they are available, and to let you know that there are many vaccine trials that are currently underway including several in our area if you're interested in participating. There are several studies that I believe in Rockville, Maryland. You can look on the NIH website and find the links and the telephone numbers to contact those people. These are phase 3 trials, which means that the safety of these vaccines have been initially documented. They have experimented with some different doses, and now they're really looking to see how significant the benefit is with these vaccines. So we still have a lot of data to accumulate, and it's going to be a little while before we have a clear answer, but I think that it's hopeful that the vaccines are underway. So we shall see how it all turns out. As they're making distribution plans, it seems like what the only conclusion that's been clearly reached so far is that first responders and healthcare workers are likely to be first in line to be able to receive the vaccine. So, and then I imagine after that they'll look to high-risk communities where the virus tends to spread easily, such as in nursing homes or prison settings or other environments where people are in close contact on a regular basis. So stay tuned for more news on that front. So we'll see. All right, then the next thing I wanted to mention, since we have a big weekend coming up, it's Labor Day weekend coming ahead, and one thing we want to pay special attention to is the fact that excuse me, so far this summer, Memorial Day and July 4th weekend, both long weekends, have led to significant spikes in COVID cases. So we're really hoping that by getting the word out to the public and educating people and reminding them about the ways that they can stay healthy, that we can keep the number of spikes down across the country. And so there were a few good tips that I'd like to mention about that. First of all, the most important would be stay home if you don't feel good. If you are sick in any way, if you have any symptoms that might signify any type of viral infection, then such as a bad headache or a cough or congestion or shortness of breath or a fever greater than 99.5 degrees, then it's probably a good idea for you to pass on the social event that you're considering attending this weekend. The other group that really should stay away is anybody who thinks they may have been exposed to someone in the last 14 days who could have had COVID-19. And then thirdly, if you've had a COVID test and you're waiting for test results, please stay home until the test results are available. You don't want to be that person who finds out that the test was positive after you've gone to a big event and potentially put a big group of people at risk. So the basic rules for how to stay safe in interacting with other people really haven't changed since the beginning of this disease process, and as we've become more aware. Even by March, we were well acquainted with the ways that this disease spreads. So one of the most important things that you can do is to remember your social distancing rules. Try to aim for outdoor gatherings as much as possible. There have been really good studies looking at why people are in super spreader situations, and a lot of this information is pertaining to small indoor groups and where there's close contact between people and where you're in a confined space with poor ventilation. So that really sets the stage for substantial spreading. And they say that 10 to 20% of infected individuals with COVID-19 are responsible for 80% of the spread. So those are high numbers in potentially dangerous situations. So You want to stay outdoors as much as possible. There was a terrific London study that looked at different clusters of infections, and they found that in 132 situations that they studied, 131 of those were in outdoor or combination indoor-outdoor environments. So we're in indoor environments or in combination indoor-outdoor environments. The outdoor environments seem to have a much lower risk associated with them, as much as 18 times less concerning. But it doesn't mean that the risk is zero when you're outdoors. You still need to be careful. And so the recommendations for social distancing are to stay 6 to 10 feet away from people who aren't in your core pod, your group, your family group, the group that you live with. And to maintain that social distancing throughout the time that you spend together. And then, of course, wear masks as much as possible. The masks are proven to be beneficial, and they really make a big difference as far as droplet spread, and also with the number of times that people have contact with their faces. You know, the average person touches their face 80, 90 times a day. So that's a lot of contact. And I think we're all learning how not to touch our faces during this whole experience. So, and then the next step really is to be conscientious about where your hands are at all times. And if you touch a surface that could potentially be infected, you know, it would really make sense to keep hand sanitizer with you. Anything that's greater than 60% alcohol content will work very quickly and can kill germs that you might come in contact with on a contact surface. You know, wipe down the tables. I don't think anybody's surprised when people bring their own wipes to events now. And then at the party, really stick to your own personal utensils, disposable plates, disposable tablecloths. Bring your own drinks so that you're not sharing glasses or coming in contact with things that other people have shared. Another thought that was interesting was to find some single-serving condiments containers so that you aren't passing around the ketchup bottle to 15 people at the barbecue. So, and really, you know, it's strongly recommended to avoid buffet lines or self-serve situations. And it's not from the food itself that the germs are spread, but really from the utensils. So those are my pointers for how to stay safe over Labor Day weekend. I think, you know, it's important for us to be able to gather and to enjoy each other's company. And it's also important to remember that we need to do it safely. So I hope that's helpful for you. So I'd like to go ahead and open it up for any questions people might have now. I'm happy to address any issues that are COVID related or about our practice. Let's see, I see a few items here in the live chat. Let me see what I can find. All right, can you tell us some tips on how to boost our immune systems while we're trying to stay healthy? Sure. I think, you know, keeping track of a healthy immune system is really, really important to do just in general, but particularly in the time of a pandemic. And a lot of the same rules that you may have heard before apply now. And those are to get enough rest, to really have a healthy diet that's got lots of fresh fruits and vegetables in it, to maintain those antioxidants and keep your body happy. Remember, we are what we eat, and a healthy diet goes a long way to improving our lifestyles. And then, you know, nutritional supplements are options for people. I tend to support a multivitamin if people have trouble with really maintaining a really healthy diet on a regular basis. There is some data to support that vitamin D is very helpful in boosting immunity or in reducing the complications of significant COVID infection. So that's an interesting one. Maintaining healthy vitamin D levels. The average person requires about 800 international units of vitamin D supplementation daily just to maintain adequate levels to stay healthy. So those are all good approaches, and then also I would just advise against substantial alcohol intake for a couple reasons. I think it does suppress the immune system, but also when we're relaxed and happy, we may not be paying as much attention in social gatherings to maintaining the rules of social distancing and wearing masks, etc. So, all right, let's see. Is there a difference between the different tests? Yes. So the rapid antigen tests are the ones that you're going to start seeing rolling on the market in greater numbers. They're still not hugely widely available, but they're becoming more and more available. I know, for example, we have a test here called the BD Veritor test kit, but we have been unable to secure the supplies for COVID-19 yet. We're hoping to have those in the next, by the end of next week. We'll see. The Health and Human Services Department has sequestered a lot of those test kits to send them directly to the places with highest need, such as nursing homes. But it is possible to get rapid tests in many communities now, and that number is just going to get better and better through the month of September. The other tests are, so the nasal swabs are the tests that really look definitively at identifying antigen, or that's actually the virus or a portion of the virus itself. And those are the ones that give you some sense of whether you actually carry COVID-19 in your system. There's another kind of test called an antibody test, which takes a look at the body's reaction to infection with COVID-19. When our bodies are exposed to COVID-19, they produce 85 or 90 proteins that travel in through the bloodstream and have various impacts in various ways. And those antibodies may help us to understand how immunity can come about to, or prevention from getting COVID-19 again can come about. And that information is very important when you're looking at developing a vaccine. So right now the antibody tests that we have available are the IgM antibody, which is a short-acting antibody that comes up the most quickly at the time of infection and lasts somewhere around 14 to 21 days after the start of the infection. Then you have the IgG antibodies, which are longer acting antibodies and usually start somewhere around day 14, but by day 28 are pretty steadily available if there's significant enough exposure to COVID-19 to develop those antibodies. And then sometimes people are checking IgA antibodies, and they're also looking at T-cell markers, primarily under research, the context of research right now for T-cell. T-cells are the cells in the bloodstream which send the signal or receive the signal to produce more antibodies, the IgG and the IgM antibodies. And so we're interested in T-cell signaling because sometimes if people are exposed for a second time and their IgG antibody levels may be down, that T-cell signaling is what tells you that there's a new exposure and you can very quickly make new antibodies to protect yourself. So more to come on the testing front. We all acknowledge that none of these tests are perfect, but it's important to start somewhere and to continue to learn about them as you go along. So, all right, let's see. Any other questions? Here's a good one. My sister and I are getting on an airplane next week. Yikes! I have masks, gloves, I know the rules. Do you suggest getting tested before or afterward for the flight? And that's a good question. I mean, I think, the need for a test really depends on a couple of things. Have you been in situations where you could have been directly exposed to somebody would be number one. And that would be for prolonged exposure, like longer than 15 minutes at a distance of less than 6 feet, most of the time without a mask on, can be really problematic for people in an enclosed space. But a trip to the grocery store, probably not so much. And then, really, if you're worried about going to see someone who is a high risk, then you can consider getting tested just to up the chances that you are not carrying the virus with you as you go. There are some travel to some destinations that require COVID testing, and there are certain states, like I know Massachusetts and Maine, if you're going to go and stay in a hotel, then you have to show evidence that you've tested negative within the past something like 3 to 5 days prior to your travel. And also many international destinations require testing. So, in all, I think if you have anything resembling symptoms, if you think you're at risk, if you're going to see somebody who's very high risk, then it doesn't hurt to get the test. We just have to remember that the tests aren't perfect. So, as far as testing afterwards, you certainly can, if it gives you peace of mind to know that your travels didn't put you at risk. But really it depends. Are you going somewhere where there are a lot of cases of COVID-19 right now and where your risk of getting exposed is high? And were you able to follow the rules as you went along? I do think it's reasonable to think that you can travel fairly safely as long as you're following the rules. And one tip I learned, which might be really helpful, is that on an airplane, the most socially distanced seat is the window seat, because think about it, half the airplane there's nobody out there. So for half of your sphere of 6 to 10 feet, it can be helpful. So hope that helps. All right. What other questions do people have? Nice to see some familiar faces. Hi, LaDonna. Anne, Eris, wonderful. Great to see everybody. All right, well, if there are no more questions, then we'll go ahead and wrap up for today. But thank you very much for joining us. And if I can answer any questions for you in the meantime, just reach out. I'm happy to help. So I hope that you found all of this very helpful, and I look forward to seeing you again soon. Take care.